The following information will help you understand what to expect before, during, and after the Mohs surgery process. Conduct a pre-operative consultation to review your health status and medications, accurately locate and make decisions regarding removal of your skin cancer, and discuss post-operative care. You are encouraged to ask questions concerning your skin cancer and surgery. Unless instructed otherwise, have a light meal prior to your surgery. A good night's rest before your surgery is also helpful. Take all medications as usual unless directed otherwise. Be sure to discuss with your dermatologist whether you are taking aspirin, aspirin-containing medications, Coumadin, Plavix, or any other blood thinner. Some additional tips to prepare for Mohs micrographic surgery are: if deemed necessary by your physician, make sure you have taken your pre-operative antibiotics before surgery. To further reduce the chances of bleeding complications, avoid all alcohol 3 days before and 3 days after your surgery. Stop smoking for a period of 2 weeks before and 2 weeks after your surgery to improve wound healing. It will be performed in our office as an outpatient procedure. We recommend that a spouse, relative, or friend accompany you to our office. You will spend most of your time for the procedure waiting while your tissue samples are being examined under the microscope. Also, we strongly recommend that your companion drive following your surgery. On arrival at our Skin Cancer Center, you will be escorted to one of our outpatient surgical suites. We will then numb the area of skin around your cancer using a very small needle and a local anesthetic. A thin layer of skin involved with the cancer will be removed. Any bleeding will be controlled by cauterizing with an electric needle. The wound will be bandaged, and you will be able to return to the waiting room. Because Mohs micrographic surgery is done under local anesthesia, each patient can expect to be awake during the procedure with no greater discomfort than when the initial biopsy was performed. Do not hesitate to ask us questions at any time during the procedure. The complete removal of the skin cancer will require 2 to 3 trips to the surgical suite. Some cancers, due to their spread into local tissue, will require more sessions to remove the tumor completely. However, even these larger cases can usually be completed in the same day. You should come prepared to stay all day, because it is likely you will require some type of repair of the surgical wound following removal of the cancer. This is usually performed on the day of surgery, but rarely must be delayed a day or so. The surgical wound after removal of your skin cancer cannot be predicted in advance. The method of reconstruction cannot be predetermined either. Following the removal of your skin cancer, your physician will consider and discuss with you the options for repairing the surgical wound. The surgical wound will be repaired by stitching the edges together or by using a skin graft or skin flap. Most surgeons are extensively trained in surgical reconstruction. This includes basic closures, complicated skin flaps, and skin grafts. Most surgeons are trained dermatologists with extensive knowledge of the skin and its healing properties. We are concerned with both the functional and cosmetic outcome of your surgical repair. Generally, your physician will perform the reconstructive surgery necessary to repair the wound following removal of your skin cancer. However, occasionally the repair may be delayed a day or so. Delay of the repair by up to a week usually has no adverse effects on healing. At the completion of your surgery and repair, our nursing staff will give you instructions on how to care for your wound. Patients should understand that there is not an absolute guarantee that any given procedure will be totally free of complications or adverse reactions. Mohs surgery is no exception. During surgery, tiny nerve endings are cut, which may produce a temporary or permanent numbness in and around the surgical area. If a large tumor is removed or extensive surgery is required, occasionally a nerve to muscles may be cut, resulting in temporary or permanent weakness in a portion of the face. This is, however, an unusual complication. The surgical area may remain tender for several weeks or months after surgery, especially if large amounts of tissue was removed. Rarely, some patients experience intermittent itching or shooting pain in the surgical area. In addition, skin grafts and flaps used to cover surgical areas may not fully survive, requiring additional repair. Some discomfort may be noticed following Mohs surgery, but severe pain is uncommon. If you have discomfort after surgery, we recommend that you take 2 extra-strength Tylenol tablets every 4 to 6 hours as necessary. Avoid aspirin or aspirin-containing products because they may cause bleeding after surgery. Bleeding or other minor complications may arise after surgery. You will be given post-surgical care instructions should any of these minor complications occur. Swelling is common following any surgical procedure, especially around the eye. Some degree of swelling can be expected, but this usually resolves within 1 or 2 weeks. All surgical wounds will drain during the first week or so after surgery. Good wound care will help minimize this problem. Infection after skin cancer surgery is unusual. However, if you notice signs of infection, call our office immediately. An antibiotic is frequently necessary under these conditions. Some degree of redness is expected following your surgery. This will resolve as the wound heals. You may experience redness at the surgical site for up to a year, depending on the circumstances of your surgery. If the redness begins to spread out from the wound, it could be a sign of infection or a possible allergic reaction to the ointment or tape used to dress the wound. Call our office if you suspect a problem.